Hi, everyone, and welcome to the session Oral Anticoagulation on Atrial Fibrillation. My name is Márcio Figueiredo. I am from University of Campinas, Brazil, and it's a great honor to be here in this session today to discuss atrial fibrillation and anticoagulation. As you all know, atrial fibrillation is a pandemic involving many countries all over the world, some countries with more incidents and some others here in our region with fewer incidents. But anyway, it's all over the world. It's a pandemic. It's a problem, social and economic and health problem for everyone. And we are here today to discuss oral anticoagulation in this situation. And we have four speakers that are very important, and we'll discuss this subject in depth taking as guide the 2020 ESC guidelines just presented and published a month ago or so during the ESC Congress. First, we'll have Dr. Gregory Lip talking us about the management of atrial fibrillation, easy as ABC. Dr. Lip is, for a long time now, studying this, let's say, global approach to the patient. He has published this ABC pathway some years ago in Nature Reviews in Cardiology. And we don't have to forget to mention that he's the one that published in 2010 the description of Chas-Vasc score. So everyone knows Dr. Lip, very important person in atrial fibrillation study and anticoagulation. We have the participation of Dr. Guilherme Fenelon from Brazil, who will talk about cognitive decline in atrial fibrillation. Dr. Fenelon is a friend of mine, and he was the LAHRS co-chair of this document published a couple of years ago, the ERA HRS, APHRS, LAHRS expert consensus on arrhythmias and cognitive function. And he will talk about cognitive decline in atrial fibrillation. Dr. Renato Lopes, a Brazilian friend of mine who's working in the US right now, is well known in clinical trials in atrial fibrillation. He's the first author of the Augustus trial presented last year during a meeting and published in New England, during the ACC meeting published in New England Journal. And he will talk us about combining oral anticoagulation and antiplatelet agents for AF, when and for how long. And to close this session, we have Dr. Hugh Calkins. Dr. Calkins is the first author of the ReCircuit trial, when they studied dabigatran versus warfarin for ablation in atrial fibrillation. And Dr. Hugh Calkins will talk us about the same topic, anticoagulation management surrounding AF ablation. Dr. Hugh Calkins was president of Heart Rhythm Society and he's studying this topic for a long time. So I hope you all enjoy the session, and I'm glad to be here with you and have a nice meeting you all.